to Psych Talk for primary care providers, where our esteemed faculty members will provide you with invaluable insights to seamlessly integrate into your daily practice. Our guest today is Dr. Jaesu Han. He teaches us some valuable lessons about motivational interviewing.
Hello, my name is Jaesu Han, and I am a professor at UC Irvine Departments of Family Medicine and Psychiatry. I spend my days as a primary care provider. I also provide psychiatric consultation to family medicine providers and supervised psychiatry residents in outpatient psychiatry. What I'd like to talk to you briefly today is about motivational interviewing. Motivational interviewing is something that I was not aware of at all during my training, and only learned after residency training. And my interest in MI, or motivational interviewing, came from my own recognition that my approach to people who were trying to or struggling with positive health change, my approach was not working. I was starting from a standpoint of the expert and telling people this information in this effort to convince them that making a change is in their best interest. And what I often got was a lot of pushback. And during my early career, I learned about motivational interviewing, and it has actually been one of the most pivotal moments in my career, recognizing there's a whole different approach that could be so much more effective in helping our patients. So motivational interviewing is essentially a person-centered way of helping our patients address ambivalence about change. And this idea of motivational interviewing came from the substance use world, but it became very apparent that it has a much wider range of use with people just trying to make any healthy behavior change. So oftentimes people talk about the spirit of the motivational interviewing and the principles of motivational interviewing and then the tools of motivational interviewing. And it can be somewhat confusing trying to reconcile what all these different terms mean when we're learning motivational interviewing. What I would say is something that has really helped me is recognizing that my job as a physician is not to motivate people to change. My job is to help people find their own motivation for change. And what I find so powerful about that is that it is not my responsibility to change people. It is my job to help people find their motivation. So rather than telling people what I think they should know, I ask people, what would they like to know about this issue? What information would be helpful for them to know? And that I'm going to be partnering with them, standing beside them, and assisting them as they move towards change. And one of the things that is incredibly powerful about this change in approach is that there is a lot less burnout, because you recognize that it is the patient's decision to change. So oftentimes learners of motivational interviewing say, well, I tried it in clinic, and I did it for 10 minutes, and the patient still decided to continue smoking, for example. And that reflects this medical mentality that my job is to prescribe and to get someone to do something. When you learn that with motivational interviewing, that it is a process, it is a way of being with your patient that over time helps the patient make a decision towards change, takes the pressure off of your own shoulders, and recognizing that this journey is with the patient together. So it is a way of being that I hope all of you learn more about. It is not something that is a sort of bag of tricks, or some people describe it as Jedi mind tricks for your patients. Because if you think about it, when I use motivational interviewing, it is to help the patient do something that they want to do it's very difficult for them to do it. So it is something that that I'm doing in the patient's best interest, and it's something that ultimately, again, the patient is the one who decides. So there's a lot more to learn and practice when learning motivation and interviewing, and I hope this was just a small snippet to help you be interested in learning more. Thank you very much.